Do you have an impacted wisdom tooth? Then watch this video. My cousin a few years back called me during the night and said, my teeth are severely paining on both sides. And I said, come tomorrow morning and have a look. During the examination and the x-ray, I found out that both of his second molar tooth on either side had a deep decay touching the nerve of the tooth, which resulted in severe pain. So as you can see in the x-rays, he had a tilted wisdom tooth on either side. This tilted wisdom tooth resulted in the harboring of a lot of food particles between his teeth, which he was not able to clean with his regular brush. Unfortunately, the decay progressed slowly and slowly, reaching to the nerve, causing this severe pain. So why does this happen? Why does these so-called wisdom tooth go in a wrong direction in many situations? During earlier years, our diet used to be a hard diet rich in fiber content. Our ancestors used to eat everything in a raw form, okay? It was more of fiber. But as years went by, we slowly shifted our diet from fibrous, hard diet to a more softened, refined diet. So the body automatically said, I don't need these many teeth, so let me reduce the space of my jaw. So the tooth number actually did not reduce, but the jaw size reduced, which resulted in the wisdom tooth going in different directions. So the next question would be, do we need to remove all of our wisdom teeth? As a part of a normal protocol in the West, every wisdom tooth on all the four sides are usually taken out. But in our country, in India or in the East, this is not followed. If the wisdom tooth is causing you trouble, then only it is considered for treatment. But in our side of the world, we only treat it if it is causing a problem. So in which situations do we need to address it? So if the tooth is perfectly under the gums, or if the tooth has completely erupted into the oral cavity, we need not do anything about it. But on the other hand, if a part of the tooth is only visible, go to a dentist, examine with the help of an x-ray if the food is getting lodged in and causing a cavity on either the wisdom tooth or the tooth adjacent to it. And if the cavity is progressing, then my suggestion would be to get the tooth out as early as possible. Well, the emergency depends upon how deep the cavity is, but it would be always advisable to get the tooth out. Usually, such teeth are actually removed through the help of a minor surgical procedure, unlike a normal removal of teeth or a tooth. So in my cousin's situation, we had to get his wisdom teeth surgically removed, and the front tooth, the tooth adjacent to it, was root canal treated and preserved. If you had found our video useful and interesting, kindly subscribe to our channel and share with your friends and relatives. Thank you.